right, so I'm Erin DiCaprio. I'm a food virologist and food safety specialist in the Department of Food Science and Technology at UC Davis. I'm going to kind of re-emphasize some of the things that both Betty and Abby touched on related to controlling COVID-19 in the processing environment. I'll talk a little bit about different chemistries that people are using against this particular virus and when and if you need to be using some of those disinfectants in your facility. So I'll start out just by saying those of you that were on the webinar last week have already heard this, but for those of you that are just joining us for the first time this week, there's currently no evidence of transmission of SARS-CoV-2 via food or food packaging. So SARS-CoV-2, so this is the virus that causes COVID-19. This is an envelope virus, and current data suggests that it only remains infectious for a few days at most outside of the human body. The transmission mode for this particular virus is via respiratory droplet, meaning that this virus must contact your mucous membranes either via aerosolized droplets that are caused by someone coughing, sneezing, talking, eating, etc., in close proximity to you, or by you touching a surface where some of these droplets have settled and then touching your own mucous membranes. So these characteristics make it unlikely that food would be a vehicle of transmission of this virus. CDC, FDA, USDA, they've all put out strong statements that this is not a foodborne virus. So just keep that in mind moving forward. However, we've already seen the impact of COVID-19 on workers in the food industry, notably several outbreaks in meat and poultry processing facilities. So this table I'm showing here was pulled from the most recent Centers for Disease Control and Prevention, Morbidity and Mortality weekly report. So this in this report, the CDC reached out to poultry and meat processors and asked them to self-report whether or not they had had any issues with COVID-19 in their workforce. And you can see to date that 115 plants have been affected by COVID-19. Uh, Almost 5,000 workers in these facilities have had confirmed cases of COVID-19. And unfortunately, 20 workers within these facilities have died from the disease. So this is specifically for meat and poultry processing facilities, but I'm sure you have all heard the reports that other sectors of the food industry have also been impacted by outbreaks of COVID-19 as well. And so while I don't believe that COVID-19 is a food safety issue, it's certainly a worker safety issue as illustrated by these statistics and information that's coming out in the news media. So there are several steps that can be taken to minimize risk of transmission of COVID-19 in the processing environment. We've already touched on many of these today, but I think it's really important to reiterate all of these concepts. So one very important measure to take is to provide training to staff on how to minimize COVID-19 transmission. So explain the measures that employees can take and the measures that you as management are taking to help protect everyone during the pandemic. Also, of course, make sure that staff that have symptoms of COVID-19 are excluded from working on site. You know, if it's a potential possibility, allow staff to work remotely if that's feasible. Though a little more extreme, you might also consider implementing some type of screening process for personnel, perhaps, you know, a daily morning check-in to see if anyone is having symptoms of COVID-19. You also might consider doing a temperature check to make sure people don't have a fever that are working in the facility. So you'll have to, you know, kind of balance, you know, worker safety along with worker privacy issues to accomplish that, but definitely something to consider. Of course, in your facility, utilize social distancing as much as possible. If you can reduce the number of employees working on a line, obviously do that. You can also consider um, changing shifts or break times to minimize person to person contact. Currently, it's recommended that you do disinfect high touch surfaces in your facility. So things that staff routinely touch, like door handles, railings, bathroom surfaces, break room surfaces, etc. Unless you have a confirmed case or cases of COVID-19 in your facility, it's not recommended that you disinfect your food contact surfaces for SARS-CoV-2, and I'll give a little bit more information on that in a minute. As always, of course, ensure proper hand hygiene and personal hygiene in your facility. Certainly, while not a substitute for hand washing, you can consider installing additional hand sanitizer stations throughout your facility to help encourage folks to, make sure that they, are washing their hands and then also using that sanitizer to minimize contact transmission. If you can't properly implement social distancing in your facility, do provide staff with face masks or other PPE to help protect them from each other. And then engage in active evaluation of the steps that you've taken to ensure safety during the pandemic, and absolutely reevaluate these processes and steps that you've taken as more information comes out related to this virus and the recommendations evolve. We've seen things change a lot over the last few months. So pay attention to guidance being put out by the different regulatory agencies, by CDC. Look out for information coming from University Extension related to any changes and recommended practices. So this table here shows risks associated with different surfaces in a restaurant facility, but much of this has crossovers to food processing facilities as well. So obviously, we've already talked about this a lot, but our highest risk surfaces for potentially transmitting COVID-19 are our high touch points within the facility. So again, these are things like door handles, surfaces in bathrooms, break room surfaces, etc. So for these types of high touch surfaces, the CDC is currently recommending that we disinfect these surfaces regularly to lower the risk of COVID-19 transmission. Now, what regularly means may be different for each facility, but generally, the more you can disinfect these surfaces, the better. So it's important to observe which surfaces in your facility would be your highest risk and develop your disinfection scheme prioritizing these particular surfaces. Right now, the risk associated with food contact surfaces and transmitting the virus is very low. As I already said, this is not a foodborne disease. So really, the recommended practice at this point from CDC for food contact surfaces is just to continue to clean, rinse, and sanitize these surfaces. So follow the process you're already using to sanitize your food contact surfaces. In the case that you would have an outbreak within your facility where you have employees coming down with COVID-19, you might actually have to disinfect food contact surfaces as a remediation due to that outbreak, but that is not currently a general recommended practice for food processors at this point. If you tuned into the webinar last week, I talked about the relative stability of different microorganisms relevant to food safety and the food processing environment. So, envelope viruses like SARS-CoV-2 are generally easy to inactivate using chemicals or heat. However, since this virus is new and researchers have yet to test the efficacy of many chemicals on the market, against SARS-CoV-2, the EPA took a very conservative approach when generating the list of agents with efficacy against SARS-CoV-2. So basically, any chemical that has shown efficacy against a non-envelope virus, something like norovirus or rotavirus, which remember are much more stable compared to envelope viruses, have been listed as also being effective against SARS-CoV-2. An important thing to think about is that most of these chemicals on the list that are available for use against SARS-CoV-2 are disinfectants, and they are not approved for use on food contact surfaces. So these particular chemicals, many of them can cause harm if ingested, and therefore additional steps must be added to your process if you're using one of these disinfectants on a food contact surface. So the EPA has published a list of antimicrobial products to use against SARS-CoV-2 on their website. So the website's listed here. You can also find this list cross-listed on the UC Food Safety website, which I put in the chat a little bit earlier today. So you can look up a chemical on this list N directly, or you can search via a chemical's EPA registration number on this website to determine whether a product you already have in-house also has efficacy against SARS-CoV-2. For all of these chemicals, make sure you follow the label direction for the dilutions, the application method, and the contact or dwell time. Again, most of these are disinfectants, and they're not labeled for use on food contact surfaces. These are typically chemicals at higher concentrations, excuse me, or harsher chemicals in general than those approved for use on food contact surfaces. If there are circumstances that require you to disinfect a food contact surface, excuse me, these are the general steps that you would need to take. First, you would clean that surface as you normally would to remove debris and any soil that might be present. Next, you would apply the EPA enlisted chemical following the label directions. The application method and contact time will vary by product, so make sure you follow the steps exactly as indicated on the label. After the contact time has passed, you may need to wipe the surface again. Just follow those label instructions. The next step is to rinse away the residual disinfectant using potable water. The rinsing step is followed by your normal application of your food contact surface sanitizer. And again, for all of your sanitizers that you're using, follow those label directions and don't change that process even if you've added this additional disinfectant step. So as essential workers, it's important to protect those working in the food industry from COVID-19. What I presented here are general recommendations to follow. The FDA and CDC also have guidance documents that provide much more detail on procedures to take to protect the food industry workforce. There are also numerous resources put out by University Extension to address these issues. So if you need help, please don't hesitate to reach out to us. We're happy to assist you. And I promise I don't have a respiratory infection. It's very dusty and windy here today, so I think I just have a little bug in my throat. So that ends my portion of the talk today. So I think we'll open it up to any questions that you have.